I jump right in, Cindy.
Jump right in,
All
Karen.
right. Good morning, everyone. Thanks for having me. As Cindy said, I'm Karin Garver, and I'm with NEAR at Rutgers University. But what actually makes me a little more qualified to have this conversation with you today, in addition to my time at NEAR, I spent 16 years at the New Jersey Department of Education, and almost all of that time in the Division of Early Childhood Education, working on these very issues, provider and district budgets, budget forms, submissions, reviews, all of those things. Some things have changed since my time at the department. I left about 8 years ago. Um, but a lot of the basics are still the same. And what I'll talk with you through today, I see in the chat, there's some folks who are longtime private providers. I recognize a few names, both from my time at NEAR and my time at the Department of Education. I recognize a few of the names on the call today. But what I'll do is give a pretty baseline description of how the process is intended to work. Understanding that that's not how it is working in a lot of places right now. But just to give you a sense of the way things are intended to go, I'm going to try to keep it as descriptive as I can, because I know there's some folks on the call who are not part of the state preschool program yet, and so some of these things might not be familiar to them. So for those of you who've been doing this for a long time, bear with me through the parts that are old hat for you, and hopefully we'll still get to some things that are helpful for you for the work that you're doing. So I think that the best place to start is kind of with the timeline and how things are intended to work from the Department of Education standpoint. And really, believe it or not, the whole process starts in the fall for the next school year. So typically in late fall or so, the districts receive information from the Department of Education asking them for their enrollment projections for the following school year. So they're, for example, they were asked in November of 2025 to submit what they wanted their enrollment to look like for the 26-27 school year. So they're projecting almost a year in advance for what their enrollment looks like. And that enrollment includes you. It includes any private providers that they are currently contracting with and or intending to start a contract with for the next school year. And the reason why it happens so early is because the Department of Education needs to get those numbers into the state's budget proposal. And that proposal, typically those numbers go to the governor's office in December and January, and then the governor gives a budget address. This year was a little late because we have a new governor, and typically they give a little bit more time for a newly appointed governor to give the budget address. But typically, the budget address happens at the end of February. And so you can see why they need to get all of these numbers, all these ducks in a row, so that the governor knows exactly how much money needs to be put into the budget to support the preschool program. Now, uh, between 2 to 3 days after the governor gives the budget address, what are called state aid notices go out to all of the school districts in the state. And those state aid notices detail exactly how much money each district will receive from the state and in what categories. So that's when the district would get their information from the Department of Education officially for how many children they are approved to serve in the next coming school year and what their budget looks like. And usually then, so that happens 2 to 3 days after the budget address. And then the district has just a couple of weeks from that standpoint, usually about 3 to 4 weeks to complete a district-wide budget that gets submitted to the Department of Education. And the preschool budget is part of that submission that happens. And it really happens in two pieces. There's a less detailed version that is submitted to the Department of Education in their overall district plan. And there's a somewhat more detailed version that gets submitted to the Division of Early Childhood Education and is reviewed by the Division of Early Childhood Education. And that budget includes information about how many, not just how many children are projected in each type of setting, but also what per child rate they're projecting to provide to each of the private providers and Head Start providers that the district is working with. So it's a little bit disjointed, that piece of things. So like I said, the school finance folks at the Department of Education aren't reviewing that level of detail. What they're seeing really is they would see a total amount that's going to private providers, but they wouldn't see a breakdown of how much is going to each private provider. That stays with the Division of Early Childhood Education at the Department of Education. There are two folks in the Division of Early Childhood Education's finance office, and those folks do a review of those budgets and ideally are looking at per child rates from year to year to try to push back on districts if they see anything that looks off, like per child rates that are going down or aren't going up. Um, I think what's been particularly challenging in the last, I'll say 15 years or so, is the way that the funding system is structured in New Jersey. We have three per child rates: one for children served in school district operated classrooms, one for classrooms operated in Head Start locations, and one for classrooms operating in child care center locations. And those rates vary for a variety of different reasons, but essentially the highest rate goes to child care providers. The lowest rate goes to Head Start providers. The reason for that is because there's an assumption that the children in Head Start centers are also receiving federal funding. And so there's a blending of those two funding streams coming together to serve children. And so less state funding is needed to fully support the cost of those children. The school district rate falls in the middle. And the reason the child care rate is higher is generally because school districts are able to achieve an economy of scale that child care centers can't. They're much larger. They can buy things that tend to be a little bit, because they're buying more of everything, they tend to get better rates. But it's also because some of their costs aren't included on the preschool budget. For example, we don't see most of their facilities costs on the preschool budget. Those are captured in their larger pre-K to 12 budget. Um, Within those per child rates is baked in funding for the district to oversee the program as a whole. So what's intended to happen is that within the, or on top of or within each of those three per child rates is a small amount of money that the district is intended to take off the top and use it for things that benefit every classroom in the program. And so that is the coaches who go to all of the classrooms, the nurses who minister to all of the classes, professional development that's provided to all of the teachers and teacher assistants, regardless of what setting they're in, and an early childhood supervisor who is in charge of oversight of the entire program, regardless of where children are being served. And so it can be a little bit confusing when you see the total per child rate that the Department of Education is sending to the district. I think a lot of times providers get confused when that full amount doesn't get passed along to them. And part of the reason for that is because of these district-wide costs and the intention that the district would take some funding off the top to cover those expenses. What's even more confusing is that there is not a standard for how much, and I think somebody just put it in the chat. What's the percentage? There is not a standardized percentage, and this is something that school districts really struggle with and providers struggle with because there isn't something clear on paper to calculate exactly how much should be taken off the top. We see districts that take $2,000 or $3,000 off the top, and we see districts that take 200 or 300 off the top. It runs the gamut. It's a pretty wide swath. I think it can be particularly challenging for districts and providers that are new to the program because they're not really sure what their expenses are yet. And so that can be a challenging thing to navigate. The other thing that I think can be a little bit confusing or misleading about the way the per child rates work is that within a given district, generally speaking, private providers do not receive the same amount per child. And I think that's something that sometimes providers get confused about. Why am I getting less per money than the child care center down the street from me? And the reason for that is because the intention or the requirement is that the district is only reimbursing providers for the actual cost of meeting the state standards for running the preschool program. So the example that I always give, and it's an extreme example, but I think it just for the purpose of illustration, it's helpful. So you could in a single district, you could have two providers that sit right next to each other, one of which has a mortgage on its building and has those space costs, and has teachers who've been with them for 10 or 15 years who have a bachelor's degree and a P3 certificate and are being paid comparably to district staff, which means they're being paid at a relatively high level. And next to them could be a private provider who's operating in a space that's provided to them in kind. So they have no space costs, and they have young teachers who have only a year or two of experience. And so the amount per child that each of those providers needs to operate the program is going to be very different because essentially your teaching staff and your facilities costs tend to be your two highest expenditures. And so the district is responsible for trying to ensure that they're only paying the provider exactly what that provider needs to meet the program expenses. And in fact, they have a requirement to recover any dollars that go unspent or aren't spent on expenses related to the state-funded preschool program. So if if the district were to give providers all the same amount of money, it puts them and the provider in the position of potentially having to give money back at the end of the school year. So they're doing their best to try to not make that happen. Again, this can be very hard in the early years of operating the program when you're still trying to figure out exactly how much money you need to operate. To assist with that, there is a requirement that providers submit a quarterly expenditure report to the district. I believe there are a few districts out there who actually use a monthly process instead, but the minimum requirement is a quarterly expenditure report that providers submit to the district they're contracting with, along with documentation of their expenses in order to verify that all of the state dollars are being spent on allowable expenses going towards the state-funded preschool program. And if they're not, then there might be adjustments made to providers' payments later on, or as the year goes. And again, the reason for that is to try to not put providers in a position of having a lot of money due back to the district at the end of the year, so that those things kind of come out as the year is going. And I think also to provide clarification, if a provider is accidentally spending the state dollars on something that's not allowable, you want to know sooner rather than later so that that can be corrected and isn't something that winds up happening throughout the course of the entire school year. And so I think the other date that's important to know, and in the contract that private providers sign with school districts, is May 1st. And May 1st is the date by which school districts need to tell contracted private providers who they have a contract with that they are intending to maintain that contract or not for the next school year. So there should be a conversation happening hopefully very soon for those of you on the call who are private providers, to give you a sense of what the district's plans are for the next school year. And then typically after that May 1st date is when the district would sit down with you with a copy of the provider budget template and have a conversation with you about what your expenses might look like based on how many children you'd be serving in the upcoming school year. And oh, something just went right out of my head that I was going to mention. Oh, just in terms of the budgeting process, for those of you who aren't part of the state funded preschool program yet, there's a an Excel spreadsheet that serves as the provider budget template, and it has a number of different forms that get filled out that include information about your staff who you would be charging to the state funded preschool program, a line item budget where you would estimate your expenses for the upcoming school year. There's a form that looks at it essentially caps the salary that the provider can charge for the director of the program. And then there's also a form that calculates how much funding, how much state funding a provider can charge to support the cost of food, in addition to child and adult care food program dollars that might be coming into the program. And so ideally over the late spring and summer months, that contract would be being signed, the budget would be finalized between the district and provider just in time to start the school year and start this process all over again, where in the fall, the district would be contacted about their enrollment for the next school year. So I know I just threw a lot out there, and I only saw one of the questions as they were coming in, but I imagine there are probably a couple of others. Cindy, I just saw one in the chat. Is the director's salary factored in? So this is a little bit of a complicated question, so apologies in advance. Yes, the director's salary is an allowable cost to charge to the program. The complicated piece of it is that if you look at the budget template, not all expenses are permitted to be charged to the program at their full cost. So I'll give a couple of examples. So the cost of the classroom teacher, the lead teacher and the assistant, you can charge at a rate of 100% to the DOE program, as long as all of the children in the classroom with that teacher are state-funded preschoolers. If there are non-state funded preschoolers in that classroom, the expectation is that the teacher salary would be prorated. Some of it would be paid by the state. Some of it would be paid by tuition from the children who aren't state funded. Then there are other positions that are prorated regardless of how many state-funded preschoolers are in the classroom. So the directors, basically all of your administrative staff salaries and benefits, and all of your support costs. So the facilities, accounting fees, security fees, and there are a whole host of those. Those are subject to two different prorations, one of which applies to every provider and one of which only applies to some providers. The first one, the one that pertains to all providers, is a proration that the Department of Education requires because the DOE only covers the cost of 6 hours a day for the school calendar year. So, for example, your facilities costs, you would enter your full year facilities costs in the budget, and then the Department of Education would prorate that by saying that the DOE is only covering 180 days per year of that cost. And the expectation is that the provider is open during the summer months and would be receiving additional dollars to put towards the cost of facilities. The other proration, it pertains to providers that are serving any children in the building who are not state-funded preschoolers. The easiest example is a provider that has one classroom of state-funded preschoolers and one classroom of infants and toddlers. And in that case, the Department of Education is going to say, we'll cover half of the cost. And then tuition needs to cover the other half. So again, I'm using very, very simple examples here, but just to give you a sense of how those work. So the answer to the question is yes, the director's salary is factored in, but it is prorated, and it's also subject to a salary scale that the DOE imposes. Can the provider negotiate the dollar amount? Yes, absolutely, and you should. You should bring documentation to your meeting with the district to say, I understand these are the allowable the costs that I'm allowed to expend to the program, and here's a history of my expenses that can back up what I'm going to budget in each of these lines. And so you should now, that said, if you go into the district meeting and say I need $25,000 per child, that's not going to be negotiable. The district isn't being given that much money. So it's going to need to be somewhere within the ballpark of the range that they're receiving from the Department of Education. But you absolutely should negotiate that rate. Um, can you mix students from districts with outside students in a classroom? Yes, this is new. And it's there, I believe now is a contract template, or if there isn't, there is one coming soon, that looks at, I think there are a couple of different scenarios that can happen. One, you could potentially have two or maybe more, but let's say two districts that both receive state funding for preschool and are both sending you children, and you're serving those children in the same classroom. What needs to happen then is an agreement not just with the provider and each district, but also between the districts, because they need to agree on which curriculum is going to be used, because one of them is going to be providing professional development, sending coaches, all of those kinds of things. And ideally, they would agree on a rate for you as well. So it just need to be a multi-district conversation. Now, if you have non-state funded preschoolers in a classroom with state funded preschoolers, that's actually quite a bit rare. We don't see that happen very often. Typically, districts are working with you for a projection of 15 kids, which is the maximum amount you can have in a classroom. It's doable, but you'll probably have some hoops to jump through in terms of documenting that you're getting sufficient tuition from the non-state funded preschoolers in that classroom to make sure that you're not using state dollars to cover the cost of children who aren't state funded. So doable, but a little complicated. Do you use the scale or actual director salary? Unfortunately, you use the scale. Um, the scale is a mix. It looks at years of experience, total number of classrooms in the building, and your highest level of degree. So whether it's like a a BA in early childhood or a BA in accounting or a master's in this or a master's in that, all of that factors in, and it's sort of a grid where you do this, and that's the maximum allowable salary. Um, Catherine, you mentioned something about a cost allocation plan. I'm not sure what that is. If you want to, oh, you did.
Kind of like I think you explained it already.
Okay.
Coming to terms of the districts coming together and
Yeah.
stipulating what percentiles are going to be covered. And
Yeah,
I was just asking, I'm assuming that this would be age and resident dependent, correct?
it is.
Meeting the admin code and all that.
Yeah, that's exactly right. So children are eligible for the program if they are a resident of the district that is receiving funding from the state, and they are either 3 years old or 4 years old by the district's kindergarten cutoff day. So, it's often September 15th, October 1st, something like that. So yes, they would need to meet the eligibility requirements of the district that's receiving state dollars. Is the funding still considered grant funding, or is it viewed as per pupil funding? So it's not technically a grant. It's state education funding. And yes, these are per pupil rates. What it's not technically is part of the state's school funding formula. Preschool funding is calculated separately from the way that K to 12 funding is calculated. I think the jury's still out as to whether that's a good thing or a bad thing. It essentially means that for most school districts, the Department of Education is providing what it thinks is the full cost of operating the preschool program, whereas for K to 12, there is an implied local share. There is always going to be some local funding that's being combined with state funding in every district to support the cost of K-12. What is a little more complicated about that is some legislation was passed last summer, and districts that are joining the program right now are subject to a cost share for state preschool. But It's a pilot program. It's only running for 3 years. And as of right now, there are just a very small handful of districts that are part of that cost share. When counting classrooms, are vacant classrooms counted in that? Oh, Trisha, that is a great question. I I don't know the answer to that. I don't think so.
I don't think
I,
so either.
in my memory, it was only classrooms that are like, for example, if you are licensed to be operating 5 classrooms, but you're only operating 4, it would be I believe the 4 would be put into that. Yeah, that's a really great question. And if you are getting pushback on that, I let me know because I would make a phone call on your behalf because I don't think that's right. Um, what are we required to do in addition to the Schedule A? So in the budget workbook, that's where you have this CACFP form. You have Schedule A, you have the district salary guide, you have the district budget forms, and then there's a statement of assurance tab as well. The Schedule A, really, you're just providing current and projected salary and benefits for any staff who you're planning to charge to the state-funded preschool program, either in part or in whole. And well, not almost all of the information that you provide on Schedule A gets rolled up into the budget worksheet. And honestly, usually once you've filled out the salary pieces, there often isn't all that much more left to allocate to the other parts of the budget. Um, the and it's really mostly Schedule A and the budget where work is needed. The other forms kind of are informational and the CACFP form, I think you have to fill in 1 or 2 numbers, but it's mostly just telling you how much you can allocate for food costs. The district budget, the director salary guide is there to let you know the max that you can budget. There's nothing you really have to do for that form except fill out, I think, your highest level of education and number of classrooms and things like that. But Lori, if that did, oh yeah, would you explain what vacant classrooms being counted means? Oh, sure. So when I was talking about the prorations on the budget, so there's the one proration that says if you have one preschool classroom and one infant toddler classroom, the DOE is only going to cover 50% of the cost. What Trisha was asking is if I have one preschool classroom, one infant and toddler classroom, and one vacant classroom, does that mean that DOE is only going to cover a third of the cost? I believe the answer to that is no. I believe they would look at the classrooms that are being utilized, not classrooms that are vacant. Okay, Nicole says one district we're partnering with couldn't fill our PEA classrooms. Contract says per pupil payments, but um, okay. So I think what Nicole's talking about is an issue of another, I know, point of frustration with providers. So the contract stipulates that if the enrollment in your classroom drops below what they call 14/15ths, so if you have an average of 13 children per classroom across your preschool classrooms, then the district would start modifying your future payments based on that. And yet it's what if the district isn't filling your classroom? So yeah, there are lots of conversations about this happening at the state level right now because we have massive under enrollment issues across the state. And it's something I know the Department of Education is digging in and looking at a couple of school districts that seem to have figured out better ways to do recruitment and outreach to get more children in these classrooms. I know that doesn't solve your problem in the immediate, but I think ultimately it comes down to recruitment and outreach and making sure that we're filling these classrooms. The other piece that I want to call out here, and this is another issue that's not resolved. I know that districts handle um, not just recruitment and outreach in different ways, but they also handle enrollment in different ways. Some are very transparent, some are less transparent. I think that a lot of providers feel that districts are filling their classrooms first and filling provider classrooms last. And when you're the ones being penalized if you're under enrolled, obviously that's a major problem. So I know there are some conversations around this issue, but no, um, I have not heard about any changes to regulations or legislation that would fix that problem. In other words, changes to regulations that would require districts to do enrollment differently or registration and placements differently. So that continues to be a problem. Lorraine, my understanding is the multi-year contract is only applied if the contract is not modified by the district. So it only applies if the contract's not, meaning they have to use that modification form if they want to do the multi-year contract. I think you're right, Lorraine, because it looks like they what I had thought the DOE would do was provide two different contract templates, one for single year and one for multi-year. It looks like what they did was provide a single year contract with an optional amendment to that contract. So I think you're right. The only way to do it is to amend the contract with that provided amendment that's on DOE's website. Um, oh, thanks, Cindy. You answered that. Clarity needed. So if we have IEP students and the IEP suggests that the child needs one-to-one, the district's supposed to cover the cost. Yes, that absolutely, that is a special education cost. That is not, it's actually not a state preschool cost. It's a special education cost. And you don't receive special education funding. The DOE or the district does. That doesn't get passed on to you. So that is absolutely a district cost. What if the IEP suggests the district is a more suitable placement, but the parents refuse? What's the provider supposed to do? Okay, that's a great question. It is ultimately up to the parents. The parents have that choice. The district can make their argument that they're a better placement, but ultimately, if the parent decides that you are the better placement for them, that's where the child stays, and the district is responsible for providing supports there. I know that's easy for me to say, but that is technically the way that it's supposed to work. Um, oh, thanks, Amanda. Yes. Parenters, and I see Grace has her hand up.
Yeah. Hi, good morning.
Hi, how are you?
Yeah, morning still. So we have a similar situation in which the district, well, we don't partner with this specific district, but we service children from that district in one of our buildings.
Oh, I see. Okay.
So what happens is that we have several children that we serve that need services. A couple of them already have an IP, and the parents have to choose between taking them to that district to receive service. But the problem is they only have a half day pre-K. They don't have the expansion. They are not part of the expansion.
Yeah.
And those parents are working parents. So they need full-time care.
Yes.
But the parents have to choose between providing service to their children or transfer them to a half-day program.
So
Is
that
there
is
a way to figure this out? And
yes, there is, and it's the parents should push back on that, honestly. What and Cindy, this would be a great thing to have one of the DOE's experts weigh in on as well. But my understanding is that the law says that the obligation is to serve the child. The first option should always be to keep the child in the location they are already in and provide the services there, unless it's impossible to do that or the parent chooses otherwise. So for the district to suggest that the child cannot receive services unless they're transported to the district is not right.
so,
Yeah. And
yeah, so
unfortunately, it's on the parents really to push back on the district and hold them to what their child has a right to receive. And it's very sad, honestly, that it often is a burden on the parents to fight for what their child has a right to. But yeah, and there are a lot of amazing services though that can help parents advocate for themselves. They'll sit in IEP meetings with
Right.
parents and provide them with guidance on the side so that, if this is their first time going through something like this, they may not know what rights they have and what rights their child has. And there are some really wonderful organizations that can help with that. Um, if they're not already connected with SPAN, SPAN, SPAN
Yep,
will help.
familiar with. Mhm.
Great. Yeah,
Yeah,
they'll
yeah,
they'll definitely help.
definitely. Thank you.
Okay, I see. Um, yes, Gwendolyn. Yeah, parent choice. That's a fight no district wants. Yeah. We have a district that has service sites, which means our children are placed in centers based on where special ed support services are provided. This means the child may be transferred to another center mid-year once evaluated and found eligible. Yeah, Jocelyn, again, like it's just not the way it's supposed to work. I mean, if you look at anything that's put out by the US Department of Education and the US Department of Health and Human Services says the first option should always be to keep a child where he or she is, to minimize transitions and provide services where they are. And again, unless it's not possible, and there are some children with some disabilities where that's not an option. But I think for the majority of preschoolers with disabilities, it is. Yeah. There's a full day definition, if I'm not mistaken, written in the law. So full day is so for state preschool, it's 6 hours is the minimum. I believe that's the case for K-12
No, I
as
was
well.
pertaining to, I know Grace was touching on, the struggle of having a part day
Oh,
when
yes.
there's specialized services, and then there's,
Yes.
that definition between, like I said, there's always this caveat of, is it feasible for the district to
Right.
provide care, right? Which will
Right.
ultimately land on them. But the reality is, if I'm not mistaken, there is a full day definition of saying that services should be compliant for full day services. So technically, if the parent was saying, what if I didn't have this other option of,
Yeah.
you're not granting me the full day of the 6 hours to
Hmm.
meet the services that I need for my child. So there's
Yeah.
always that kind of little advocacy that can play a role
Right.
when you're advocating for your child. Because again, just because we're able to grant the remaining hours doesn't mean that they're meeting the full day definition of what's written in the law.
Sure. Yep. And Trish, is there a reason why the budget requires providers to have auto insurance? I didn't think that it did. I know you have to have like general liability and like I thought it was written into the contract which insurances you have to have. Um, but yeah, if they're making you have
Vehicle
auto insurance.
insurance if you're providing transportation, obviously, but that
Yeah, but if you're not, that's nuts. Yeah.
There is something in there for covering automobile.
I mean, if you have one, sure, but if
I
you don't,
don't.
why you would, yeah, that could just be a silly clarification that's needed on DOE's part to add if you have, if you are transporting children, where it's just somewhere along the lines those words didn't get written in and the district is reading into it a little too far. Okay, well, Cindy, I think I took up way more time than you were intending. Sorry about
I
that.
let the conversation go because I thought that was way more valuable to get this information
Okay.
out there rather than our breakout discussions. So
Okay.
I really appreciate your time
Anytime.
and knowledge and
Anytime.
joining us today. Thank you so much, Karen.
Yeah,
Um,
absolutely. Always happy to talk with you all.